Okay, everyone, we're just going to start the meeting. So could I take nominations for a chairman for the municipal year? And could I remind you that it needs to be a councillor? Councillor Bray?
I would like to propose Councillor Hare, please.
Do you have a seconder? Do we have any other nominations? Okay, could we take a vote on that, please? Could I see all those in favours, please? Thank you very much. Councillor Hare is now chair. Apologies.
We now need to appoint a vice chairman. Have we got any nominations? I'll propose Debbie Milligan.
In that case, I second Debbie Milligan. Thank you.
Can we have a vote on that, please? Oh, are there any other nominations? Sorry. I don't think so. So can we have a vote on that, please? Thank you. Now we look at, are there any apologies?
Graham Ebers and Steve Moore and Helen Watson.
And Matt Pope asked me to say he probably couldn't come because he's not well. And also I know Clive Jones is coming, but will be late. Can we look at the minutes of the previous meeting? And are there any comments on those? Don't think so. So do we have to vote on it? So we have to vote on this. Can we vote that we approve the minutes of the previous meeting? Thank you. Do we have any declarations of interest? No. Thank you. And now, are there any public questions? There are no public questions and members' questions, none of them either. Okay, we've been asked to change the order of running because is it Amanda Lyons? Amanda Lyons has another engagement. So we're going to look at number 10 first, define the Bob ICS development roadmap. And I think Amanda's going to lead on that.
Thank you, Chair. By way of introduction, I am it's Amanda Lyons. I am the Interim Director of Strategic Delivery and Partnership at Bob ICS, and I'm bringing for you today an update on the ICS's development. I'm going to take about 5 minutes to take through the short presentation, and which I'm hoping that you have in front of you, and I will then happy to take any questions. Can I just confirm you've got it in front of you? Would you want me to share my screen?
Could you share your screen, please?
Okay. Hold on. Just bear with me. It's not playing ball. Nope. Right, if you can just start, I might need to switch computers. If you just bear with me, because it's not having it. Just bear with me. I'm just trying to bring it over.
Amanda, it's Tracy. If you want to forward to me, I can share for you.
Would you mind? I'm just having awful difficulty. Yeah, just
ping it across to me, Amanda.
No worries. Thank you. Coming. Oh dear. I'm having awful IT problems. Just hold on. Sorry, Tracy. Got it. Right, it's coming. All right. I do apologise. I might be able to try something else. Hold on. Right. Tracy, did that come through?
It's not arrived yet.
Oh, I'm in a different office and the trying to. I do apologise, Chair. What I'm going to try and do is join the meeting, rejoin the meeting on a different laptop. Is that if somebody can let me in, then I can share off a different laptop. Is that okay?
Yeah, that's fine.
Yeah, 1 moment.
It's arrived, Amanda. Is that coming through for you, Amanda?
Presentation now?
No. Yes, we can see that. Thank you.
One more go. Can you see my screen?
Yeah, we can. It's easier if you put it on slideshow so that it's bigger, but we can see it.
Thank you. Sorry, could you hear my? Are you able to see my screen and hear me?
Yes, we can.
I do apologise. Right, let's. It's just not happening today. Right. Are we good?
Yes.
Right. Thank you. And I do apologise. It was just the technology was just not happening. So what I'm just bringing today is an update on the ICS and its and how it's been developing over the past few months. So what I'm going to cover particularly the ICS development, an update on the system delivery plan, and then describe for you the preparations that are underway pre-establishment of the ICP of the strategy, just to keep you up to speed with the work that's ongoing. So some key development activities in April and May are that the ICB Constitution, which is an NHS document, has been submitted to NHS England, and it has been approved at the end of May, and which is great news. We are working on the people and community strategy, and there is an ICP working group which is being led by the chair designate, and that's met a couple of times and is ongoing. There's what's known as a readiness to operate statement. This is really the nuts and bolts of the practical requirements of folding in the 3 CCGs, and that has had both internal audit and regional office from NHS England review, and pretty positive clean bill of health there. And the important thing here is also the CCG staff TUPE transition consultation has closed, and actually since drafting the full notifications have been underway, and there is an interim executive team in place. We were required to submit to NHS England as part of the ICS establishment a year one establishment plan. That was completed for 31 March and is posted on our website, and there's a link in your papers and in the presentation. That sets out really the forward view of how the ICB, particularly its architecture, will be forming, and then gives a sense of the ICS development journey that will be underway for the next 12 months. And it's really, its essence is really as a bridging sort of strategy, and to give some direction of travel to follow the legislative requirements. And I'm sure you will understand that following the granting of royal assent, the focus has primarily been on the establishment of the ICB as a statutory legal entity on 1 July. So really focusing on making sure that the staff are paid, that the bills can be paid, and there is the right governance ready to go. So standing financial instructions, etc., for day one. Just to remind you that that integration is one of the key drivers and the principles in the system delivery plan, and we've tried to hold true to the objectives that were set out and now in the Act and subsequent guidance, that the aims of the ICS are to improve population health, to tackle inequalities and outcomes, enhance productivity, and and to help the NHS support the broader social and economic development. And this is just a snapshot of some of the aspects of the plan. As I said, you could expect the focus of the work is two-phased: ICB architecture, so that's the NHS legal entity, and then the wider ICS development. The ICB architecture has been the primary focus, but we've had a clear chapter approach, and with real focused work streams to make sure we move this forward. But we are very keen to make sure that the focus is, yes, on governance and structure and all of those sort of the principles, but we don't lose sight of some of the core ICS areas of focus, which are really quite new to the operation of this entity. It's got a bigger focus in these areas, so digital and BI, making sure we are stronger in diversity and inclusion, tackling inequalities absolutely at the heart of what we do in a way that probably wasn't as clear back prior to the Act, but it's what it isn't is an operational planning delivery framework. You won't be able to read this, but this is really setting out some key outcomes in time. And I was only this afternoon just reviewing, actually, have we done what we said we'd do for the first month and as we head to July? And I'm really pleased to report with one exception, we remain on those outcomes are definitely holding true, and the exception is that at the bottom, by the end of this month, it's anticipated that there was going to be a costed digital strategy. That was an NHS England requirement, and the timelines have changed thereof. I want to reassure members that actually, whilst the focus for the last 6 to 9 months has been on the preparation ready for the establishment on 1 July, and we've run that through a programme office type approach, that actually with the future establishment of the ICP and the integrated care board, that we will use the governance of the entity to really make sure that we keep evolving and moving forward with the ICS's development. I'm just going to move on to give you some headlines of the ICP strategy and its development, and I'm really keen to stress that this is pre-establishment sort of preparation, so nothing has been decided, and nothing, we're just making sure some early groundwork is put in place, because the timelines for completing any strategy are quite tight. Now there's been the 3-month slippage with the bill receiving royal assent in April, which was later than anticipated. So we've been trying to just get ourselves ahead of ourselves to make sure we can achieve the requirement that is an ICP strategy, an interim ICP strategy, to be produced by 31 December 2022. So working with Tracy and other colleagues from across local authorities and health, we've started to make sure that we've reviewed the 5 health and wellbeing board strategies to inform our strategy development. We've been focusing on the NHS England's focus on health inequalities core 20+5. I've mentioned we've establishing the working relationships, because this isn't an NHS document, it's an ICP document. We're underway understanding the requirements of the ICP strategy. The guidance is due out in July, so we're just sort of watching what we're doing, and we're just underway to sort of develop a fact base of information, which will include each of the joint needs assessments, but actually particularly from an NHS perspective, we haven't been used to looking through the lens of performance and finance thoroughly at the ICS level, so it's a very useful document for that. Just a snapshot here. As the ICS strategy and ICP strategy is underway for 22-23, it's important though we're not without some priorities. So we're really we've worked through to see what those would look like, and the system development plan sets out 4 areas: children, adult mental health services, the urgent and emergency care, elective, and for health, the reduction of agency usage across our providers, which is being led by Berkshire Health and is wider than just Bob ICS. I'm not going to go through that slide. Just want to, this is also the summary. I just want to show for your information really, the summary of the health index and actions by each of the local authorities, which just shows the difference that that when you take this upper level to the ICP, that there's some consistency of that we need to focus on, but also there are some, there will be some differentials that we need to be aware of. I'm going to pause there, and I do apologise once again for my the IT that just wasn't playing ball for me today.
Thank you very much, Amanda. Has anyone got any questions they want to ask? Councillor Bray and then Councillor Margaret.
Quite a lot of those slides are quite small for us to see on the screen. Can you send us that presentation to go out? Thank you.
Councillor Margaret.
Thank you, Amanda. You are probably not aware, but James Kent attended this meeting earlier this year, where councillors of all political persuasions and GPs and members of the voluntary sector raised concerns about the structure of the ICS, the lack of accountability for local members, and the big gap basically between the local level and basically where the ICS and ICP is going. Now, I note that what you've just presented, there's a lot about governance and structure and forward plans. As Councillor Bray's pointed out, there's some information presented. I can't read it off the screen and we've not seen it before, so I've no way of basically making any judgments on it. I think, really concerned basically about the objectives of the which you've just outlined as are not going to be met with the current structures basically as they are proposed. And yeah, again, personally, on my personal level, it may be a view other councillors share here, it may not. But expressing concern that the residents of Wokingham are going to be forgotten about here with this structure, the lack of accountability, and also the fact that Wokingham is not a place in this world. Basically, it's part of West Berkshire. And I know you're not going to be able to answer that now, but I'd really hope you take those concerns back.
Thank you. I can't answer all of them. No, you're quite right, and I will absolutely take the concerns of the board back to Dr. James Kent and to the chair designate. One thing, though, I will say is that I will be in regard to the development of the strategy. I have a draft of a letter. I was waiting to learn of the election of the chair of this of your board to arrange to meet to discuss the proposed approach to developing the ICP strategy. So I'm committing to that in the meeting, and I will absolutely take back your concerns.
Thank you, Amanda. I've got Councillor Jones wants to give this, but I'd just like to, yes, say that we might be on different political sides, but certainly I very much agree with Councillor McGretz that we need to be assured that the voice of Wokingham is heard in the ICS, in the ICP, in Bob, everywhere, and that we believe that Wokingham is a place. West Berkshire isn't a place. West Berkshire doesn't even exist in the NHS now, and certainly it's not a county. And that is something which is very important, we believe. And we believe that Wokingham is the place that our residents relate to, and so that's what we think is important for them. That's just a statement. But Councillor Jones.
Thank you very much, Chair. You just said exactly what I was going to say, which was to agree with Charles. We really do have to have our own board. We have to be, as councillors, absolutely assured that our voice is going to be heard, and the voice of our residents, because we talk to our residents on the doorstep on a regular basis, all of us, all of the councillors on the council, and we need to make sure that the Wokingham voice is very strongly heard. Thanks.
Are there any other questions?
That's an innocuous thing to start off with, but I know I'm going to say what I think, because this is my first meeting on the board for some years. I was on it when it started, and then came off it and I've come back. So unfortunately, what I'm hearing is the same sort of thing that I heard when I was on it before. What I'm deeply concerned about is not just Wokingham's voice, but the voice of local government in public health. And what we're getting is, even on your slide, a big slide saying NHS priorities plus 24 or whatever it was. I'm interested in public health priorities for local government, which is a slightly different thing and is likely to have more of a primary care focus and a different sort of thing. So I at the moment I'm feeling very NHS done to, and not very local government done with. And that is a message that I hope you are getting from everywhere else, because I suspect it's what all the rest of local government feels as well.
Councillor Bray, if I may come, just seek to reassure you on this. In terms of, I recognise I absolutely recognise what you're saying in relation to me sharing with you NHS priorities. The work I have done to date with the directors of public health on the initial thinking around the integrated care partnership strategy, which is there to inform the NHS's 5-year joint strategy, is very much around the wider determinants of health and the prevention and the health inequalities aspect of this. So we are really keen to take areas, start well, live well, age well as core areas of the strategy. So I'm really pleased that you raised that, and it has reminded me of the importance of those close relationships that I'm establishing with the directors of public health for exactly the reason that you have just said.
Thank you. Councillor Muggates has another question.
Thank you. I think two things. Firstly, and you'll have to forgive me, basically, I get my ICBs and my ICPs confused, basically. But there is the one board, which is the management board, which just entirely consists of health professionals. There is the other board, basically, which has, if I remember correctly, one representative of local government there, but who's not there to represent government, is there to advise. Forgive me if I've got that wrong. And one GP. And I think I don't disagree with many of the aims of this operation, basically, but I can't see it will ever work unless there is proper representation from those parties on there. I have raised these concerns in the past, basically. When I was chairman of this group, Dr. Kent had committed to meet me on a monthly basis to discuss them. Now, it's obviously up to Councillor Hare what he does, and I'm not here to speak for him. He's perfectly capable of doing that himself. But would you please pass on to Dr. Kent that, if Councillor Hare wishes, basically, that offer could be extended to him so there can be some constructive dialogue. And David, I'm not meaning to speak for you. It's entirely your choice, basically. But I thought I'd make that public so all knew exactly where things were.
And obviously, that would be much appreciated if I could have a monthly meeting with Dr. Kent. That would be valuable to put our point of view and to help him know that Wokingham wants to be heard and Wokingham matters, and the local authority of Wokingham needs to go forward as a unit. And if other people from West Berkshire want to have meetings for Dr. Kent, that's up to them. But certainly Wokingham wants to go forward in a strong and committed way.
Thank you. I will pass that on to Dr. Kent, and I do know that Javed Khan has written out to the leaders of the 5 local authorities to explore and discuss further the concerns which I have heard from other local authorities. But rest assured, I will pass your comments on.
Thank you very much. Susan Parsonage.
Hi, Amanda. It's Susan Parsonage here. Just a couple of questions. In terms of the assurance that councillors are seeking, what assurances can you give with regards to ensuring that the Wokingham voices are heard in the structure that you articulated? I wonder if you could say something about that. And also, there are a lot of groups. There's a plethora of groups that have been set up to engage with local authorities from the 3 different areas and other Bob local authorities. I'm wondering how can you bring clarity to this in terms of making it a bit simpler about what the purpose of the groups and what they're doing and just so it's more understandable, because it's a very sort of like complex structure. And I'm just wondering how you can do that for us, make it all a bit simpler.
So I think at the moment, because we're in the ICS is in its forming stage, I think there are probably more groups that are there where engagement is trying to sort of take place as part of the forming, Susan. So I can see that it is probably more complex than that. In the system delivery plan, there is a reasonably sensible schematic which does set out the sort of going forward, the assurance boards of the ICB, and also then how that fits to the ICP in governance terms. But I will go back and check in terms of the streamlining of how the sort of engagement groups at the moment, Susan, are sort of being pulled together, because what I'm hearing from you is that it's more onerous and confusing than is helpful.
That's right, and I have asked for a picture, or a sort of organogram, if you like, of the different groups and their purpose and anything else that brings some clarity to this, but not nice at keeping it simple.
So there is in this system development delivery plan a high-level schematic of the core groups, but I will go back to and speak with Catherine Mountford as to whether that I'll contact you directly with Catherine to make sure that if that fulfills what you're looking for, or whether something else would be of help.
Thank you.
Are there any other questions that anyone has? I don't think so. So I think that's it. So I'd like to thank you very much, Amanda. Sorry that you got a torrid time from our questions, but I hope it shows you the feeling that is very strong and not political, but throughout Wokingham, that we want to do the best for Wokingham, and that's obviously as councillors, that's our way. But we want to be heard, and we want to be asking the right questions and getting the right answers.
Thank you.
Okay, so that was defining the Bob development roadmap. We're now looking at the pharmaceutical needs assessment, and this is a paper that basically we have to do, and then it goes to the NHS, and we get no other input in it, which seems a bit crazy, but that's the way it is. So I think, was it Tracy who? Yes, you've done this.
Good afternoon. Thank you, Chair. I'll just introduce Gabe, our public health consultant in Wokingham, who's going to do some slides to this and talk you through it for the decision this afternoon.
Good afternoon. My name is Gabriel. I'm an interim consultant in public health, working with Ingrid. And this presentation is to just set out broadly what a PNA, that's pharmaceutical needs assessment, is, and what we've done so far, and the highlight of the outcomes that we have derived from that. And so without further ado, I'll just proceed. A PNA is a statement of pharmaceutical services, needs related to pharmaceutical services in a specific area. And it is a legislative requirement based on the 2012 Social Care Act for local, that is the Health and Wellbeing Board, to develop and update the pharmaceutical needs assessment. And the PNA needs to be updated every 3 years to ensure it reflects the current needs of the population. And this document that is before you is to help us fulfill that obligation under the legislation. Locally, due to COVID pressures, it wasn't possible for capacity within the local authorities to develop the PNA, which is required to be published by the 1st of October this year. So for that reason, healthy dialogues were commissioned to develop that. And as required by the guidance, the overall process was overseen by a steering group, which was duly constituted based on the guidance and included the health watches across the Berkshire, and the patient representatives, and emergency management, that is optimization teams, and then as well as the local pharmaceutical committees across the area. As part of the process, the needs are assessed, and then the needs, that's health needs, and also an assessment of possible future needs are assessed. And the next few slides will take us through what are the approaches that we're taking to do that. The key element of changes in needs is dependent on the population of the local area. And locally, based on the projection, it is anticipated that within the lifetime of this pharmaceutical needs assessment, Wokingham population would increase by 2.4%. And the biggest increase in the population size would affect those who are aged 15 and 20 to 24 years, which will be around 7.3%, and those aged 65 and over, which is estimated to be increase by 6.4%. The other one is to do with development, that is housing development locally, and this is over the lifetime of the PNA. Potentially, there could be an estimated 3,451 new developments within Wokingham. Fitcham South Ward is expected to have the biggest development overall. Within the PNA, when conducting the PNA, there are criteria used to assess accessibility to pharmaceutical services. And one of the key ones is the 1 mile radius from the center, from the postcode to the nearest pharmacy. And the second one that has been used is, and that radius is considered to be adequate for coverage for the pharmacies. And locally, they have 20 minutes travel time by car has also been considered to be accessible. And where no coverage has been identified, other factors are taken into account, for instance, GP prescribing practices, public transport availability, and then also the population density overall. Now, the assessment, the needs assessment have assessed sufficiency of provision, and across the major areas, that is essential services, advanced services, and other services, the needs assessment concluded that overall, there is sufficiency of provision for the current time and also for the foreseeable future, that's from 3 years from now. However, cognizance has taken of the fact that there are potential population increase pressures, as well as increases in the development, which will also add to the population growth. However, even though those may put additional pressures, they are mitigated by other things to do with how services are commissioned, being provided by other agencies, and also we have in many areas currently, distance dispensing is one of the key developments in pharmaceutical services delivery. Now, from here, we, as part of the the development process, it is required as a statutory requirement that we do a 60-day minimum consultation and preceding the publication of the final report. So the draft that is presented before you is we intend to take this to consultation from tomorrow until the 9th of August. That will be the 60-day minimum. And the final P&A will be published on the 1st of October after approval from the board. The statutory consultees are listed, and all of them will be duly consulted within that time period. Now, so given all that we have presented, we are asking the board to approve the draft needs assessment to be taken out for consultation, and the board members to comment on the needs assessment, and then also to note the next steps in the development of the needs assessment, leading to its publication on the October 1st of this year. And that is the end of the presentation, and I will pause here for questions if there are any, and for clarification or as interim comment on the report that you have so far read.
Thank you, Gabriel. And as you said, this is for the DNA, the report to go out for consultation. It will go out tomorrow for 60 days. And so it isn't the final thing, but obviously we can all speak on that. Are there any questions about it? Councillor Bray and then Councillor Margaret.
Thank you. I've got, it's a sort of a question and a sort of a segue out of it. So, from what I understand, this is a statutory thing that we have to do. And once it's approved, it's gone out for consultation, it gets into its final form. There is nothing, it doesn't come back to us. We don't do anything as a result of it. It goes into the NHS somewhere and somebody decides on the pharmacies. So, first of all, is that an accurate summary of the situation? And the second thing is, so what do we do about pharmacy provision in our borough if it's not via this? What levers do we have to pull for services?
Is that question for me to address, or that's just a wider question for everybody to comment on?
Maybe you can answer the first part. This is yeah.
So, this is a statutory requirement of us to deliver the needs assessment. Yeah. When the NHS is making a decision regarding pharmacies, they do make references to the PNA in every given area. And pharmacies are, that is those who are intending to make application for opening new premises will be required to make reference to that. If there are obvious needs, then they will use that. However, there are other alternatives, routes for them to open pharmacies within the area. So 2 of them that can be mentioned are where there is unexpected benefits to be derived, they could open new pharmacies, and where they would want to do distance dispensing, selling pharmacies, they can open new pharmacies within the area. But everything will be based on the information currently available, based on population density, which has been analyzed within the PNA, as well as the distance from the accessibility of pharmacies. Ashley is the lead on the needs assessment. She may want to add a few comments in relation to that.
I just wanted to add actually as well, if there's been any major changes to the population or to housing that have been unforeseen, the Health and Wellbeing Board can opt to revise the PNA earlier, or to make like an appendix, in addition to the PNA, to that will make additional or changes to the recommendations for NHS England in regards to applications for further pharmacies.
Thank you. Now, Councillor Margaret, you have a question.
Thank you. With no disrespect, Gabriel, this may be more an Ingrid question because it relates to something from the past, which is I remember during the vaccination programme, we had great problems getting coverage in Wokingham. And in particular, there were only a small handful of pharmacists basically who were offering vaccination. Now, I note your comments in this report basically that it's considered there's enough pharmacy provision across the borough. The two may be unrelated, but I thought it was worth asking the question.
I'll answer that, Charles. Thank you. A good question and good observation. I think that they are in this instance unrelated, in as much as any of our pharmacies could have and could have applied to deliver COVID vaccinations, and just 2 of them did. What levers there might be to encourage more activity within our pharmacies is I think beyond the realms of the PNA, but an interesting question in and of itself.
Thank you. Councillor Bray's got a...
Yeah, just as a follow-up on that one question, extremely annoyingly, the pharmacy in Sainsbury's in Winnersh was advertised via the NHS website and via Lloyds themselves as a centre for vaccination that allowed you to book appointments. And my husband went for one and they didn't actually do them. So he actually had a booked confirmation from a pharmacy that did not offer vaccinations because of the way Lloyds had set up their IT system. And we complained and they have not responded at any stage whatsoever to why they allowed their IT systems to allow you to book vaccinations at a pharmacy that didn't offer them. So there are lots of things to do with pharmacies and the quality of service that don't seem to be addressed by a needs assessment. So I think I kind of like to know is what we can do about quality of service as well. If anybody's, perhaps Ingrid or somebody can answer on that, or Tracy maybe.
I think Tracy can probably add, but I think I would just say, Councillor Bray, that unfortunately the quality of service is something governed by those that commission the pharmacies, and that's centrally commissioned, and we have very little hand in that. But I wonder whether we could potentially take this conversation further offline and think about whether there was anything we might be able to do in terms of understanding residents' experience or particular areas where there might be an issue. But I don't know if Tracy wants to add.
Yeah, good evening, everybody. I would, sorry, I should introduce myself for those who don't know me. I'm Tracy Daskovich, Director of Public Health. I think Ingrid's absolutely right. I think there is something about taking advantage of the 60-day consultation period and making sure that we have got the opportunities to have those conversations and understand the needs of the people using services. So really happy to have a conversation, see how we can best do that.
Thank you. I don't think anyone else has a question. I've just got one which I don't know whether you'll be able to answer, but on page 25, the stop smoking service in pharmacists patients who start their not stop smoking journey in hospital. There was no further information on that. Is that something that's being looked at, or is that something that just there isn't any information there?
That service is a new initiative being rolled out nationally, so it doesn't got universal coverage currently. The expectation is that in due course, when those who have been, the lead pharmacists who are doing the pilot currently, if it is found to be beneficial, then it may be rolled out. But ultimately, it will depend on the local commissioning process as well as outlined previously.
Thank you. Okay, so I believe we need a vote to send this out. Yeah, votes on the recommendation. So can I have all those in favour, please? I think that's unanimous. Okay, thank you very much. Right, now we're going to move on to the Wokingham Borough Wellbeing Report, the annual report. I'm not sure, is this Ingrid or is this?
Thank you, Chair. I'll just introduce Lyndon Mead, who's the senior officer who's been pulling together much of our work around the Wellbeing Board strategy and our Wokingham strategy into action, and he's pulled together this annual report and is going to introduce it to you for your noting. Thank you.
Thanks, Ingrid. Thanks, Chair. Yeah, I haven't got any slides prepared, but I just want to take 2-3 minutes just to talk you through the report, explain what we got and how we got to where we are with it. As it says in the tin, the annual report details the work of the Wokingham Health and Wellbeing Board and its subgroups over the last financial year, so April 21 to March 22. The report focuses on the progress that's been made across the partnerships to improve health and wellbeing in Wokingham, but it's also an opportunity to look at the objectives for 22 and 23 beyond. As Ingrid alluded to, it's been a group effort to pull this together. It wasn't just from the public health team. There's a lot of the content has come from the 8 partnership action groups that are referenced in the report. Just quickly going over what's included in the report. So in summary, you've got an overview of the membership of the Health and Wellbeing Board and its core functions, which hopefully you're all familiar with. There's quite a section on how the Wokingham strategy interaction, our local health and wellbeing strategy, came into being. As you may be aware, it was derived from the joint Berkshire West strategy, thus it shares 5 priorities, but these priorities were workshopped, if you like, locally by Wokingham colleagues and partners and residents to make them more locally relevant. We also added a 6th priority to the strategy as well in relation to promoting or improving levels of physical activity, as it felt this was also important for Wokingham. The rest of the report is made up of individual sections from the 8 principal partnership action groups who oversee delivery of the specific objectives within the strategy. And within their individual sections, there'll be a look back on what's been achieved in the last 12 months, plus their plans for the upcoming 12 months. Obviously, a lot of last year was still heavily impacted by COVID and its continued impacts on population health and wellbeing and service delivery. But despite this, there was a lot of progress made, and hopefully that comes through in the report, not least the publication of the aforementioned strategy and the formation or reforming or strengthening of those 8 partnership groups to deliver the strategy. In relation to this, there's been a few governance changes where we now have the Health and Wellbeing Board steering group that meets on the alternative months to this formal Health and Wellbeing Board. And that group will help to oversee, scrutinise and support delivery of the strategy interaction. It's fair to say we're still on a bit of a journey working with the groups in the delivery of the strategy. I think they were all in different places when the strategy was published, and some of them were more robust and set in their ways of performance management and delivery and their operating processes. But we are working with all those groups individually and with the steering group to get them all into a more robust reporting space, if that's the right word. This will not only help in actual delivery of the strategy, which we know is happening, but actually help us evidencing that delivery, which then enables us to make changes if we need to, and also produce future reports and future annual reports. Couple of other key highlights are in the report. I won't go into too much details. Appreciate you can read the report yourself. But there's our new joint strategic needs assessment site on offer. We've got a new website hosting this function, which was pulled together in conjunction with the Berkshire West Public Health Share Team. But as well as actually having a better joint JSNA offer, we also have a new offer again this year, where you can get direct support from the public health team to help working with colleagues and partners interpret data and actually work on specific pieces of needs assessment. We've also got work of the CYPP included in the report. They've been doing their development of improved joint Berkshire West CAM service and also working towards a UNICEF child-friendly communities accreditation. The Community Safeties Partnership have produced a new domestic abuse strategy and also commissioned domestic abuse services and substance misuse services. We've also got the Wokingham Integration Partnership Board, who've continued delivery of the Better Care Fund programme. Again, we've overseen, despite COVID again, strong hospital management and discharge services this year, which are better than most of Berkshire West and also some of the strongest in England. So again, I say this despite the headwinds we faced last year, there's still been a lot of progress made, but I won't go into too much more detail and leave you guys to read the report yourself. But I'll throw it there to any questions that you may have and do our best to answer them.
Thank you very much, Lyndon, and thank you for letting us read it ourselves rather than going through it. Have we got any questions that anyone wants to ask? Councillor Bray and then Councillor Jones.
Yeah, sorry. We had a presentation at the Children and Young People's Partnership on Monday, I think it was, so it's been one of those weeks, I think it was Monday, about the JSNA. And I would like to say how much better it is to have the observatory as it is and actually be able to see the data effectively more up to date and live and not in the format that the JSNA has traditionally been. So that's really good. I did unfortunately have to send a small email to the public health email address about 3 or 4 minor things that didn't work. So I hope that those can be sort of updated. Just annoying little bits that the postcode search just doesn't work, doesn't do anything, and the deciles in the bar charts are in the wrong order, so it doesn't go 1 to 10 or 10 to 1. It goes 1, 8, 9, 10, 2, 3, 4, 5, 6, 7. For some reason, those kind of things. But on the whole, it's a really good project. I was really pleased to see it, and I think it'd be really useful.
Thank you. I'll just say, yeah, we welcome all feedback. If anybody does have an opportunity to use the website, please do. And yeah, any feedback like that and any functionality or ways you think it can be improved, it's greatly appreciated.
Councillor Jones.
Thank you very much. Yeah, thank you, Lyndon. My questions are going to be about CAMS, and I see that for children in care, we're recruiting some people now, so that they can do assessments, and that service is going to be launched in the autumn of 2022. So what sort of reduction in assessment times do you think that there might be once this service gets going? And this is for children in care. How about children who are not in care? What can we do to bring down assessment times for those children as well?
I'll take the opportunity to back this over to Vicky. I can see as the caller, she's obviously better placed to answer this than we are in public health. So hopefully Vicky can chime in.
Oh, hi, thanks very much. I'd need to go back for specifics about that, Councillor Jones, to our commissioning colleagues who are commissioning the service for children in care. But safe to say, for children in care, it will come down substantially because it will be dedicated to children in care in Wokingham. So that I do know. What I don't know is about everybody else, and because we have a tiered system for mental health services for children, it'll very much, the waiting time very much depends on which tier the child is entering into. Some of it of which is in the gift of Wokingham to control to some extent, and some of it isn't. The higher tier services, for example, are not commissioned by Wokingham, but are health services. So if you don't mind, I'll go back to my commissioning colleague Hayley Rees and ask for some information about that, if that will be okay.
Yeah, that's fine. You say some of the areas are not commissioned by us, commissioned by other people. Can you let us know who those people are so we can start to put some pressure on them to improve their assessment times as well?
Yeah, absolutely.
Okay, thank you.
Thank you.
Thank you very much. I can't see any other questions. No, so we've got to approve that and recommend it to go to full council. No, but that's just the councillors, yes. This is just for the councillors. Do you approve? Sorry. Can the board approve this and recommend it to council? All in favour? Okay, that's unanimous. Thank you. So we've defined Bob. So now we're looking at the forward programme. Let's run through it. We're just going to go through this and ask if anyone's got any extra things they want to add to this. 11th of August is the next full Wellbeing Board. Still got any things that they'd like to add to that? Charles?
Chair, not necessarily, could be any of these meetings, but I felt we had a good meeting last year where I don't know whether it be the CCG or the ICS, but we asked to come and talk to us about GP performance in Wokingham and various issues. And I was going to suggest that as an agenda item at your discretion, of course.
That would probably be a good idea sometime, though I'd have to declare an interest. Anyone else for the August one? Then the October one. We are looking and saying, is a COVID update as necessary now? Because although COVID is still occurring, it's died down quite a bit. Do we need it? I mean, certainly I think it'd be good to have a report perhaps in the December meeting of how we've got through COVID and things like that. But do we need an update on regularly? So I think we might take the one out for the October meeting, but keep it in for December for a full report for that. Any other things that people have?
Can I ask a question about it? Because obviously I've come back, this is my first meeting. The strategy into action item that we have on there, how substantial is that as a discussion? I mean, do we get a full discussion of all the different groups and a full ability to talk about the whole lot?
That happens in the other bit, the bit that isn't public. That's when they come every quarter, each group, and does a presentation, and we talk about it and things like that.
So when we're kind of presenting it or having a slightly different discussion on the strategy into action item in the public agenda. Yeah, okay. I think when we do that bit, it's just any bits that need to be discussed, that need decisions or whatever it is. Yeah. Okay.
That's the more general when decisions are needed and things like that. Councillor Jones and then Tracy, put your hand up.
Thank you very much. Could we have an update on how our new children in care CAN service is going? Could we have that in February?
I think that would be a good idea. Just to, even though it's only just going, it should be starting, as it needs to go on in many ways. If they can recruit the right people. Tracy, I believe you have a question, something.
Thank you so much, Chair. It's a suggestion. Previously, the suicide prevention strategy had come to Health and Wellbeing Board as a draft document. We're currently working through a refresh of that document following policy and guidance changes. So we're putting in place a interim framework for dealing with suicide prevention with a view to holding a summit in the autumn. And a draft strategy to come back to Health and Wellbeing Board in January to launch the consultation period with a view to having the substantive document in place around spring of 2023. So it's possibly that this could be an agenda item in its different stages for the next 3 Health and Wellbeing boards, so that they can keep the board up to date with the progress of that, with your approval, Chair.
I personally think that would be very useful, and certainly yes, I know our suicide level might be apparently low in Wokingham, but one suicide is one suicide too many. And being married to a GP, I do hear of some. So certainly it's something which is important, and I have a real interest in that. So thank you very much.
Thank you for your support, Chair.
Does anyone else any questions or comments? Okay, well, that strategy we'll go forward with, but if people do have things, if they want to send them in to Madeline or me, and so that we can talk about them and perhaps introduce them into the agenda, I'm quite happy, and I'm sure Madeline is, to hear of other issues which people want to talk about, because I want this to be a live group, not we've got to go through with it. It's something that we have to do every other month, and then the intervening months are more interesting. But I want this meeting to be live as well. And say, like the suicide, interesting things which we need to get our teeth into and find out what's happening and working. So do feel free to come to me with any questions or any issues that you want to be discussed in this meeting. So we can now close the meeting. Thank you all very much for coming, and do feel free, as I said, to contact me if you've got any questions.